Previously on the Dr. C
heard
show.
about you guys because I Googled buccal fat removal because I've always had an issue with my lower face being kind of wide.
Here we go, All right, hello, Ben Coughlin here with the one and only Josephine Silver.
Hi guys, I'm Josephine, but you can call me Josie.
Josie, and she's got her tag, so we'll include them somewhere here. Back to plastic surgery. So why would you, I mean, you're young, you're pretty, why would you want to change your face? Like, we can do a little consult, kind of see how it goes. I mean, I won't get into too much detail, but I can give you my 2 cents.
Yeah, so I've always had, here, I'll pull my hair back a little bit. I've always had these like wide Polish cheeks here, and they're cute, but I wish I had more of a contour. And even right now I have, you know, my full makeup done. You can probably see I do a contour every day, but when that's not on there, I really don't have any sort of line of demarcation. Like, it's just one flat, you know, surface. And like a lot of people, I think that looks really good when you have the cheek and then the contour. Like, that is the look. And I don't want to get it from filler. I want it to look natural, not the structure.
So there you go. So this like peaks and valleys I talk about. I mean, I have my beard now. I'm putting my beard in for the winter, so I used to be able to show it better. But people like a nice peak, the little bit of a valley, which is what you're doing with your contour, highlighter, all that kind of stuff. Then a nice straight jawline, then a little bit of a valley under there. So the buccal is for sure an option for someone like you. You got to make sure you like that kind of sculpted look. Right. Most of my patients do. Most people with a round face after the age of 20, they're like kind of sick of it. They're like, okay, I'm ready to kind of get that sculpted look. So buccal fat is for sure one thing we can do to like make your face more sculpted. If you bite on your cheeks, I suck them in and bite on them. So what you're biting on there is the buccinator mucosa and muscle, and that's what I've added to the procedure. So most people just make a little nick, most surgeons, and then they take the fat out, they sculpt it, and that's it. I take a little wedge of what you're biting on there. That's the buccinator mucosa and muscle. So
you take out a piece of the
I take a whole wedge, and the muscle, the mucosa. Yeah, we use those at the county. I was at the county this morning. We use those the portions of the anatomy to reconstruct like the lower eyelid. We actually reconstruct the penis if it gets trauma. Because it has a similar mucosa. So I was doing a lower eyelid case, and I was like, oh yeah, you know, it's interesting. I took it on the side of somebody's face, and it made the face a little more sculpted. I was like, oh, interesting. And I was doing a lot of buccal fat at that time.
Is the muscle like down here more?
That muscle is the buccinator muscle. It's the one that helps you like move your food around inside so it's the whole cheek has a big fan-like muscle in it.
Okay.
So yeah, so the muscle goes, it's like when you open your mouth, it's like this fan muscle right in here. So, you know, I just take like a nice wedge out of that, and what it does is it kind of pulls up that pre-jowl.
Totally.
So
I have such an issue with that.
You don't really have,
Like me personally, maybe not.
Yeah, and so the other extreme in someone like you would be some sort of little bit of chin structure. So you're thin. People that are thin and think that they have a round face often have like a little bit of a softer mandible. That's this bone. Yeah, here, I'll draw it. I'm going to exaggerate, okay? We'll show that. This is good. This is like, I'm ruining my consults for everybody. There's a couple ways to like sharpen a face, a couple key ways. It really is all about volume in the right spots, okay? So I'll kind of show everybody. So there's somebody who's really round, and there's somebody who's sculpted. So here is the buccal, but look, if you lengthen that chin just a little bit, you keep it looking pretty good. And we have a couple metrics that allow us to make sure people look normal. If you keep the face split into these thirds, then you keep somebody looking normal, meaning that their chin's not going to dominate their face. Right. So your chin is a little shorter than it could be, I guess, is the way. So it's not that you need a bigger chin, but if you take your fingers and put them right there and kind of pull forward. And you see, it's hard because I don't have a mirror for you, but if you do that in the mirror, you'll see that narrows the area. So,
oh yeah, I know, I've done all the things.
Yeah, so there's a lot of options.
I've totally noticed that before, and I thought I was like going crazy. I was like, how could your chin make a big difference?
Yeah.
But it does.
Yeah, if you take your lower teeth and put them out in front of your upper teeth, do it.
Yeah.
And you got a nice broad mandible. So your profile here is great. Like you have great demarcation. Like people pay a lot of money for that.
Well, okay, I just got my nose done in September. I'm Italian and Polish, so I had like a big Italian nose.
Both have big buckles too, yeah.
Yeah.
Like there's certain people that have big buccal fats, and there's certain people that have not so big. So.
Anyway, when I got my nose done, I realized a big part of that side profile that people like is your nose and your chin come to the same point in your face. And so I got my nose smaller and that helps, but now I need the chin to come meet it.
A little bit. The balance, the nose and face are intimately, the nose and chin are intimately related. Also the lips we use to line up the chin. So you draw a line from the upper lip to the lower lip, and then it just kind of shows you again. So most people don't come to me like you're kind of intuitive about it, it seems like. Most people don't come and say, you know what, I could use a bigger chin. They say like, I don't like this or I don't like that. And I'm like, good, we can use your chin to make your face more sculpted. So I think those are all options. We can do a formal little consult one of these days and talk about it. But, and then there's different ways to do it. People start with the buccal, then they do a little chin filler, see if they like it. You kind of play with it, Once you prove to yourself that it's something you like, then you decide maybe I'll do the chin implant because it makes more sense from an economic perspective. So, but I mean, you're changing your face subtly. Most of these things are subtle. The people that I get like really big changes and they look completely different typically are doing like a combination of things, to get to get that look. So.
Right. Well, that's like the essence of what Chicago is, right?
Pretty much.
You do like a custom combination of things to create sort of that dramatic before and after.
I say this a lot, but we got people over here that want to be Instagram models, dramatic, and I got people over here that like don't want their boyfriend or girlfriend to know.
Right.
So there's, most people fall in that paradigm somewhere, but it really is tailor-made, So the key to happy patients is making sure you and I are on the same page about the results. I mean, I can give good care. I'm going to give good results. The question is, what kind of results you want, The errors I see, the revision cases I do of like other surgeons and stuff, it's not normally like they did a bad job. It's just like they were on different pages. I mean, of course there's bad cases, but a lot of times like, people thought they were going to get one thing and they end up with a different thing. And that's the difference between the doctor and the patient. So having a similar aesthetic, like I obviously like the buccal fat contour. I think it's attractive. There's many surgeons out there who don't think it's attractive. Typically it's older guys or women. But yeah, there's some people who kind of like that rounded look. Most younger people now kind of want that more sculpted look, the Ariana Grande, Angelina Jolie kind of stuff. So, okay, well, that's our story and we're sticking to it. So,
all right, well, thank you for having me.
You're welcome.
Bye, guys.
Bye-bye. Like, subscribe, comment down below. Stay tuned for more plastic surgery, commentary, videos. You're going to just feel hotter watching them.